When do early pregnancy symptoms start? Regardless of your feelings about a possible pregnancy, it can be easy to ascribe any sensations you're having to potential pregnancy symptoms. However, keep in mind that premenstrual syndrome, PMS, symptoms and those of early pregnancy can be very similar, and pregnancy symptoms most often don't occur until after you've missed a period, not before. Early pregnancy symptoms. Some of the earliest signs of pregnancy include slight bleeding or spotting, fatigue, tender, swollen breasts or nipples, headaches, mood swings, frequent urination, food aversions or cravings, nausea and/or vomiting, also known as morning sickness. Having symptoms a day or two after having sex is usually not a sign of pregnancy. Here are some things to consider as you try to determine if you're pregnant. Nausea. Nausea immediately after sex is something you may question as a sign of pregnancy. However, your body doesn't have enough time to react to produce that symptom due to a pregnancy resulting from recent intercourse. For most pregnant people, pregnancy-related nausea begins 2 to 8 weeks following conception. So, if you were having pregnancy-related nausea, you became pregnant weeks before. Pregnancy test. A pregnancy test is the best way to tell if you are pregnant or not. However, you must wait until you miss your period to get the most accurate results from a urine pregnancy test. This can be a home pregnancy test or a pregnancy test from your doctor, midwife, or health department. A blood test, quantitative beta-HCG, might show positive results as early as 1 week after ovulation. Basal body temperature charting. Basal body temperature, BBT, can predict and suggest ovulation. This only works if you have been taking your temperature in the days prior to ovulation. Temperature elevation, approximately 0.5 to 1 degree Fahrenheit, begins 1 or 2 days after ovulation and persists for several days. When pregnancy is unintentional. If you had unprotected sex or a contraceptive failure and fear you could get pregnant, emergency contraception is an option. Commonly called the morning after pill, medications are available over the counter, without a prescription, that can prevent pregnancy if taken within 5 days of having unprotected sex. The sooner you take these medications, the more effective they are in preventing unintended pregnancy. These medications do not cause an abortion, but rather prevent a pregnancy from being established.